And if there's a reason to recommend it, we're going to recommend it because you want to make our reps happy, want to make the hospital happy.
Yep.
And unfortunately, that seems to be real too.
Well, it's very real.
So that's real too. So that's a real possibility in today's modern age. And I'm sure there are people that fall into the former. I'm sure I know doctors that are great human beings and they really enjoy being able to help people.
Yes.
It's just that's how a system works. When a system has the opportunity to make more money by doing certain things, it's not the scientists that are trying to do that. It's like there's a whole system.
So with the drug companies, and I think this is true of doctors too, it's not that they want people to get better. I do believe that, okay? But once you've invested $1 billion or $2 billion in a drug and you've brought it to market and it's gotten FDA approval, you're going to do whatever you can to protect it. And that means generally exaggerating its benefits, and if there are problems with it, doing everything you can to hide those problems.
And that's almost like a fiscal responsibility
to your shareholders. That's
company,
right. That's right.
Which is really crazy. That's what's really crazy. What's really crazy about it is that money and medicine are all combined. And it's not saying that doctors don't deserve money or the people that develop medicines don't deserve money. They certainly do. They work really hard. But what I am saying is when you have anything that gets wrapped up in a lot of money, people want to make more.
Yeah. Yes.
They want to make more. Like,
Yes,
how do I make more?
Yes,
I don't like making, X amount. I want to make Y. How do I get to Y?
Yep.
What do I have to do? I got to sell this. I got to do that. I got to make some unnecessary these or those and do a few things to people that maybe they didn't need.
Yes. And it's okay because maybe it benefits them. It probably doesn't hurt them that much. You justify it.
And then there's real things that people thought were conspiracies. Real things like incentives. And that showed up during the pandemic as well. That they got paid per case for people that had COVID, and they got paid per COVID deaths, and the whole thing was weird. It's like if you financially incentivize the treatment of a pandemic disease, that seems like I understand that hospitals have to make money, but isn't there a fear that you label something COVID death, you get more money, that people would use that on things that weren't necessarily COVID, especially if there's no oversight.
Oh, yeah, of course.
They're not combing through your fucking books.
That's right. And if the worst thing that happens if they do comb through your books is you have to pay some of it back. All the incentives. That's right. Exactly.
Sorry.
Exactly. We upcoded a little bit here. We cheated a little bit there. We'll give you a check.
Elon talked about it on the podcast and people said he was making it up.
Nope. He was not making it up.
He was saying if you got bit by a shark and you had COVID, they would call it a COVID death.
Yes.
It's just like, what?
And this is still going on, Joe. This is going on until 2025. If you're a family member and you can get a family member who died to be classified as a COVID death, you get up to $9,000 for their funeral expenses. You submit it to FEMA, they cut you a check. And so, of course, those families want they want $9,000. Who wouldn't? I mean,
yeah, it's free $9,000. Your loved one's already gone.
Yes.
The whole thing is just so slippery because, you would, if everything was perfect, you would say maybe it would be good to help these people at the funeral. Maybe it would be good if you.
But why is
COVID
saying? Different than anything else? If
good question.
Right? Why do you get $9,000 for COVID and nothing else?
Right.
No,
what do you think it would be like if people started promoting that for obese folks? If you're obese and you die,
you get $9,000. It would bankrupt the federal government.
Grandma was obese.
People respond to incentives. When there's money, companies respond, doctors respond,
right?
everybody. Yeah, I mean, I guess, unfortunately, look, it's why we have this, all these great things in this country too. But
yeah,
I will give you. So an ophthalmologist called me a few weeks ago. There's a drug, and the drug works. Okay, it's good. It's good for people. If something called wet macular degeneration. Okay, it's something that older people get, and it can blind you. So there's a drug. There's a couple drugs that actually work for it. They block the flow of they block blood vessel formation at the back of the eye. They help you. So these are administered, ophthalmologists administer them in their offices. So a drug like that, the ophthalmologist actually buys and charges Medicare or the private insurer for. Okay, what's happening, And I saw this with a different drug when I worked at the New York Times 15 years ago. So nothing ever changes. These companies all play the same games. Is that the companies that make this drug are giving doctors a rebate on the purchase price. And the more you use, the bigger the rebate. And this is a drug that costs thousands of dollars per person per year. Okay, it's dosed multiple times a year for a lot of these people. So what all this adds up to is if you're an ophthalmologist who's using a lot of this, the company is cutting you a check for 5 or sometimes 6 figures, sometimes multiple times a year. Okay, don't tell me that's not a bribe. Okay, because that's a bribe. It may be legal. They may have found a way to do this. And he showed me the check that his company or that his ophthalmology practice had received, and it was huge. Okay, and by the way, these doctors make a lot of money on their own just doing the procedure. They don't need this, but it's a way for the drug company to get them to use this more. There's corruption all over our medical system.
And how does that get resolved? Is there a way at this point, or is it the system itself? Is it just a function of that's how human beings behave when they have, enough regulation where they can get away with some stuff, and they just want to make more and more money, and it just becomes that's what they're trying to do?
I don't know.
Is it just human beings?
I mean, if you're that ophthalmologist in Florida, do you need another Ferrari?
But maybe you don't think that way. You don't think that way. You just think I can get it.
Right.
And I'm in this system, and the system is fucked already.
That's right. And I'm using this drug because I know it works and it's good for patients. The problem is you're then having incentives to ignore the problem if there is one later. And so in this case, the guy actually said to me, he's like, this is a good drug. It does work. He said, but sometimes if we dose it too many times, there can be sort of a paradoxical effect where it stops working. If you're one of those doctors who's on the tit and getting that check every quarter or every 6 months or, however frequently you get it, it's going to be harder for you to see the problem because all of a sudden you have a financial incentive not to see it.
Right.
I don't know what we do about any of this. Except talk about it and make sure people know.
Talk about it, make sure people know. And, you need senators that call this stuff out. And we need, people that run these companies to have to have ethical boundaries, because they make great stuff. The thing about pharmaceutical drug companies is I would never say we don't need them. That's crazy.